for keeping it tuned right here on Newsnet. I'm Charlie Tinker. Around America we go. October, as you know, is Breast Cancer Awareness Month. Cancer patients and oncologists as well have many new treatment options available to them. In fact, the FDA has approved some 87 new treatments in just the last 5 years. However, for most of these treatments to be effective, what's called a genomic test is required first. We're joined today by somebody who could explain that. Dr. Neil Iyengar, a research oncologist with the Breast Cancer Research Foundation, and cancer patient turned advocate, Karen Peterson, to discuss this further. Thank you both so much for taking the time.
Thank you.
Thank you for having us.
Absolutely. Dr. Iyengar, we're going to start with you first. Can you give us kind of a working layman's definition of genomic testing, which I understand is different from genetic testing, correct?
That's absolutely correct. So genomic testing is a way to personalize or individualize a cancer treatment plan after a person has been diagnosed with cancer. Genomic testing looks at the DNA or the genes that are in a cancer cell, and it identifies mutations that can be found in those cancer genes or cancer DNA that may not be present in our normal cells or the normal healthy tissue of our body. Genetic testing is different. Genetic testing, which more people are typically familiar with, looks at the DNA or the genes that you might inherit from your parents or pass down to your children. These are genes like the BRCA gene, which can increase an individual's risk for breast or ovarian cancer. Genomic testing, on the other hand, is specific to the cancer cell. And what that lets us do is identify treatments that can target the cancer cell or attack the cancer cell while sparing the normal healthy tissue in our body. It also helps us identify clinical trials of new drugs coming down the pipeline that may be beneficial for a particular individual.
Interesting. So it sounds like you're more or less describing a kind of a proverbial treatment roadmap, right?
That's what it is. Yes, it's a way to personalize and develop that roadmap.
Interesting, very interesting. So Karen, we'll move over to you. You were diagnosed with stage 4 breast cancer 2 years ago, which turned out to be metastatic, right?
Yes, that's correct. In 2017, I was diagnosed with stage 4 triple-negative breast cancer. So when you talk about roadmaps and how important having information to use as a tool to help guide me down that roadmap, you know, genomic testing was a game changer for me, because without that information, I don't know if I would have went in the direction that I was supposed to be headed. It really narrowed down my field of choices, and it helped me identify a clinical trial that was, you know, particular to my mutation. It was targeting my mutation. Once I got my genomic report back, it indicated that I had mutations that were particular to my tumor. And that's when I said, okay, I'm going to find a trial that's targeting this particular mutation. And genomic testing helped point me in that direction. So it was really a useful tool.
Absolutely. So very much a roadmap to you, and certainly an amazing hope for you. So for all of our viewers out there, what was the first indicator you saw that you were actually sick with this cancer?
I would have to say, because I had prior cancer in 2015 and had been treated, you know, you have a sort of protocol. So you see your doctor every 6 months, you see your oncologist every 90 days. It depends on the individual protocol. Mine was to see my oncologist every 90 days. I went for the checkup, and she did a blood test. It indicated there were some levels that were off. And then she said, okay, I think you should do a CT scan. And I took the scan, and it indicated there was activity going on in my body in various parts. And so then she said, I think you should have a biopsy. And at that point, I decided, okay, I better start doing some research, because if this biopsy comes back positive, I need to have a game plan. So that's exactly what happened. I got my biopsy back in April of 2017, and it was confirmed that I had metastatic triple-negative breast cancer.
Oh. And obviously, information, you know, the best weapon, I guess, in this fight. So doctor, how do you go about learning more about the process of genomic testing for our viewers out there?
Sure. So individuals who've been diagnosed with cancer or who are interested, their families, caregivers, can go to testingmycancer.com. This is a website that will give you more information about genomic testing. You can also look to the Metastatic Breast Cancer Alliance. This is a patient-led advocacy organization for individuals and their families and friends who've been touched by metastatic breast cancer. It allows the use of several tools. They have an app, for example, called MBC Connect, which is a tool that patients can use to connect with other patients, to learn from each other, but also to identify clinical trials, like Karen mentioned, that may be useful for them.
Very interesting. So, Karen, if I could ask, what is the status of your cancer today?
I'm really lucky, and I'm glad you asked that because I'm proud to be able to say that as of my last scan in September, it said that I had no evidence of disease, NED. So that's really important. I'm very humbled and very thankful.
Absolutely. Congratulations.
Thank
You're
you. Thank
now
you.
an advocate. How did that happen? And I guess, what does that role mean to you as somebody who has suffered from this?
I think the role is very important to me because I feel like I'm paying it forward and paying it back. Because I can remember in 2017, I was looking for stories from individuals and patients who had already been treated, who were successful in finding a voice and finding a way through the journey to become empowered and find a treatment plan that was working for them. And I can remember seeking those stories out and connecting with them and thinking to myself, one of these days, that may be me. And I feel like, it's just a part of the process. You each one teach one. So it's really important that I pass the word on that, it was an informed choice. I just didn't decide, I'm going to roll over, get out of the bed and go into a clinical trial. No, it was an informed choice. I had tools at, my disposal and I used them. And I want everybody to know that genomic testing is very important when it comes to your cancer treatment in regards to trying to make informed decisions about a treatment program.
Absolutely, so well said. And all the best to you, Karen, moving forward. And
thank you.
Yeah, absolutely. Thank you both, Dr. Karen, for your time. And thank you as always for keeping it right here on NewsNet. For Around America, I'm Charlie Tinker. But don't go anywhere. More news, weather, and sports right around the corner.